So sleep apnea, it worsens your personal relationships, decreases work productivity, increases occupational accidents and motor vehicle accidents. Also, other medical conditions associated with sleep apnea are fibromyalgia, as Ken mentioned earlier today, Barrett's esophagus, GERD, secondary polycythemia, and Down syndrome, because they're mid-phase deficient as well. Also things like heads, like Ehlers-Danlos, I see a lot of that. They have breathing and sleep issues as well. So the prevalence is as high as between 40 to 80% in patients with cardiac conditions. That's one of the things that, again, Colin Sullivan said in that article, that he's shocked that, a patient comes, they tick the medical history, they have a heart condition, but then why aren't people asking them what's going on with your sleep? Because there's a high association there, anywhere from 40 to 80%. So why do I teach airway and sleep? So this is the data from medical schools. So firstly, 6 dental schools in Australia, New Zealand, average 4.5 hours of sleep medicine training. I had 0 hours at UQ. 4-year medical school in USA, including Harvard, had less than 2 hours of formal education on sleep. And 30% of the schools in America had no education. 12 countries across Asia Pacific have less than 2.5 hours. More developed countries such as Australia, USA, Canada spend usually around 3 hours on sleep education. So approximately 1 billion adults globally aged 30 to 69 have sleep apnea, and of which 425 mil are moderate or severe. So, and so it's estimated 15 to 22% of sleep apnea patients can subjectively identify symptoms to warrant them seeking medical assistance. So we estimate that 82% of men and 93% of women are still undiagnosed. A lot of it's obviously lack of education to both the general public and at university, obviously.